My name is Professor Leonard Funk. I'm a consultant shoulder and upper limb surgeon and professor of orthopedics and sports medicine. I'll be talking to you about shoulder instability and shoulder dislocations. Shoulder instability or dislocations occur when the structures that stabilize the shoulder are unable to work any longer, and the shoulder either becomes unstable or dislocates and comes out of joint completely. This may occur in two main situations: either a traumatic dislocation or instability, as you see here with a typical rugby playing injury, landing on the shoulder and it pops out of joint. That's traumatic instability or dislocations. Another type is known as atraumatic instability or dislocations, and this generally is where the joint is far too loose, something that some people are born with, and it just gradually overstretches and becomes unstable and comes out of joint due to the stretchiness and also muscular control of the shoulder joint. So the key stabilizers in the shoulder are here the muscles which start right down at the bottom of the trunk and work all the way up to the shoulder, known as the kinetic chain. Very important muscular stabilizers of the shoulder. In addition to this, you see the shoulder joint here from the front, and this blue lining here underneath the muscle is known as the capsule. The capsule is a very important structure which lines the joint and gives it stability, keeping it in joint. In addition to the capsule, the joint is lined by a structure known as the labrum. And the labrum lines the socket of the ball and socket joint much like a washer, giving it stability. So should you sustain a tear or an injury to the labrum or the capsule, this can cause instability and dislocations of the shoulder. Here you see a shoulder seen from the top, looking down. The front is upwards and the back is downwards. And here you see what happens with a dislocation where the shoulder pops out forwards, and you can see it impacting the humeral head on what's known as the glenoid, the socket here. And that is a typical dislocation. The dent is known as a Hill-Sachs lesion, and the injury to the front of the shoulder is often known as a Bankart tear, or you can get a capsular tear. For acute dislocations, the shoulder is generally manipulated back into joint. This is generally required to be done in hospital under sedation or an anesthetic. Recurrent dislocations generally need more treatment. For atraumatic recurrent dislocations or recurrent instability, where there is no true tears, no structures broken, these should be managed with specific physiotherapy, working on building up the muscles of the shoulder, helping to build the nerve linkages between the brain and the shoulder joint, and trying to learn methods of coping with the instability. For traumatic injuries where there are structures torn and damaged in the shoulder, generally surgery is required, and these structures need to be fixed. The commonest injury is that known as a Bankart tear, which you see on the image over here on the bottom right. Here we're looking at the socket side on, and you can see the tear towards me here. That usually requires repair. This can be done as a day case procedure nowadays by keyhole surgery, although it can also be done with open surgery, and the results are very much the same. You should be able to go home the same day after the surgery. You'll require a sling for a while afterwards and physiotherapy. The details of the surgery will be discussed with you by your consultant surgeon. Here you can see the repair, and these are what are known as suture anchors, fixing the broken labrum, the Bankart tear, back to the glenoid and fixing it in place. Generally, the return to sports is about 3 to 6 months following the surgery with sport-specific rehabilitation, and the risk of recurrence after surgery should be less than about 7%, but this will be discussed with you by your consultant surgeon. For more information, please see the website shoulderdoc.co.uk. Click under the patient information section and look at shoulder dislocations under the shoulder section, or click on the link below.